Hey friends, welcome back here at Full Life Chiropractic. So today I'm going to talk about what we do with patients that are in pain. I'm talking serious pain or maybe not such bad pain, but believe it or not, people come to chiropractic to stay well, not just because they're in pain. And usually pain is the tip of the iceberg, so if you are in pain and we're not really treating your pain, you are going to start feeling better with the adjustments little by little. But if you're in severe pain, I have things that work really well that can help get you out of that acute phase of pain. So the adjustments, of course, are the primary tool that we do in this office, and that's helping your nervous system to release stress so that your body can heal from within. But when you're in that much pain, we have other things. So we have something called electric stim. You probably heard of it. It's like an electrical current that goes through you. We attach these pads to parts of your spine or neck that are in a lot of pain, and it pushes a current through these that actually breaks the pain. It like speeds the pain current or the pain, I can't think of the word, but basically this is electricity. Your body has electricity flowing through you, so it beats the pain impulse by having this electricity get there before, and it kind of pulses. It blocks the pain impulse, but it also reduces inflammation because it's pushing blood flow in there and pushing the good cells in there. And then it's also helping the circulation to help heal the area. And of course, it kind of feels like a good massage, and it just relaxes the body and calms the muscle spasm down. So muscle spasm is reduced, pain impulse is reduced, inflammation is reduced, and muscle spasm is reduced. And this we don't do on every visit. This only we do when someone's in a lot of pain, just so you know. I know there are chiropractors that do it on every visit, but that's not what we do here, because we're more of a wellness-based practice. So you might have, if you have sciatica, we'll do one on your butt, down your leg, and 2 on the low back. If it's upper back, we'll do 2 on the upper back, 2 on the mid back, and you get the picture. We also can do it on small areas, but for small areas, I'll show you what I really, really love. We also have ultrasound, but it's not my favorite for small areas. I love laser. So this was one of the first lasers that came out. It's the Dynatron 702 model. And I just want to tell you what laser is. Laser is actually light therapy. So how does light therapy work? This is very quick. Light or photons are applied to the tissue. So basically, it's like, let's say I injured my wrist, right? I press this button and the light impulses are going right into my wrist. And I'm holding it there, and it's completely safe. It's like the power of the sun, but very specifically directed and formulated to bring a therapeutic effect to the cells. But I just wanted to read to you. It doesn't feel hot. You're not supposed to look directly at the light. But basically how it works is the light photons are applied to the tissue. The photons are absorbed by the chromophores in the mitochondria and cell membranes. These absorbed photon energy is converted to ATP, and then the additional ATP accelerates DNA and RNA synthesis, mitosis, and cell proliferation. The result is tissue repair, pain reduction, and accelerated resolution of inflammation. So this is amazing for small areas, again, hands, wrists, elbows, shoulders. You can even do it on sinuses. Never do it on the thyroid because you can damage the thyroid. Knees, ankles, feet, toes. It's fantastic. It's completely safe. plantar fasciitis, tennis elbow, even on jaw pain, you can do it right on the jaw. It doesn't get hot at all, and it's completely safe. The one that I have. Now, there are different models that are more intense and more dangerous, but I love this one because it's so gentle, but yet very, very effective. Some other things I do in my office for when people are in severe pain, I use a technique called Factor. A friend of mine, Dr. Dorr, created this technique. It's similar to Graston. You use this kind of cool tool, and then I use CBD, my favorite CBD, which is medicinal, and then I just take some of that CBD off, and then let's say the person has like an elbow problem, right? So I'll just take some of the CBD ointment and just like scrape the muscles of the elbow while the patient's like moving. It's even more effective if they're moving. And just dig deep in there, and what's going to happen, it's going to break up scar tissue in there, because what happens is the body lays scar tissue down whenever there's a damage to any kind of tissue in the body, and that's how it repairs. But the scar tissue can also, create problems of its own. So we're breaking up the scar tissue to increase the blood flow again and bring fresh new cells and new blood to the area, and like to restructure that area. So between using this, breaking up the scar tissue, and using the CBD ointment, we get really fantastic results. I love using it on the traps, on the neck, on knees, elbows, wrists again, even on the low back, in shoulder also, different parts of the shoulder. So, and one last thing I'll just share with you today is I love this company, FIR. It's the infrared tourmaline company. Some friends of mine are the owners of the company. They created, this is tourmaline, like the crystal tourmaline. It's basically bonded into this tape. They have other products as well. But the thing with this tape is the crystals increase oxygenation to the cells, which is fantastic. So I would tape a patient up in whatever area, if I think at the time it would benefit them, that they need. And that this tape is waterproof or water resistant. It lasts up to 3 days. You put a specific design of the tape on that body part, and it just basically supports the area. It brings pain relief to the area by stimulating the receptors, the pain receptors in that area. And the patients just feel really good. They feel like it's supporting them, and it's relieving the pain, and it's just helping the body heal, because those tourmaline crystals are very powerfully healing modalities. They're minerals, and basically how they describe it is the tourmatate can produce a mild flow of electrons that can be felt by some users as a slight tingling, which is normal, and then you can shower or bathe with it, and therefore it could be wet, and it's not going to lose the effectiveness of the tape. So those are just some more things that we do here at Full Life Chiropractic. I hope that helped you. Make an appointment, because you deserve to have the best health ever. You really do. Your body's designed to heal. Your body is strong. Your body is healthy. Your body knows how to heal, but you know what? You might not have been doing things to support it, and that's what we're here for. We're here to teach you how to help your body heal better and give you the tools and the therapy so that you can thrive. And right now, we all need all we can get to be strong and healthy with the coming months ahead. Thanks for listening. Have a good one. Bye-bye.